Okay, so what I'm going to talk today is just to give a quick view what was being a midwife during the pandemic for this last year. Looking at this last year, the COVID-19, it just made worse existing situation of pressure and struggle, and they made this we can say it's like a circle of situations, because we know that during the COVID-19 we started to have more situation of inequalities, inadequate working conditions. We had a lot of pressure. This led to having staffing shortage. We have sickness. We have self-isolations. We had people needed to leave for carrying responsibility. And for those who left, is more stress, is more absenteeism, is a turnover, and people want to quit. But all this situation, what this means, is affecting our compassion as a midwife, is impacting our professionalism and our effectiveness. This picture, this feeling tree, I think is really good, because it's about every time we wake up, we have different mode, and it's really important to respect each other, because we are not always everyone in the same level. I can be number 21 as I can be number 10. Absolutely. Working during the pandemic, what happened is the situation of the unknown. We didn't have any answers, and was constantly a change, and this made a pressure, more stress. Was difficult management, because it was something that we never faced before, and everything linked. You don't have answers, you have a massive change and difficult management from everyone. And as well, the thought of death. I felt it especially the first period of COVID, constantly talking about death. But as well, what it meant be a BAME, be a Black, Asian, ethnic minorities, facing that dilemma of I'm staying or I'm leaving. Is about what is the important decision in life, is about what is my priority, is my work or is my family back home. And this as well, providing reassurance in difficult times, because it's not something that a situation we face just as a midwife, is as well our patients, the birthing partners. They can attend or they cannot attend. Usually they have two birth partners. Now it is one. Sometimes even the only partner can attend. How we can reassure our patient, the partner that can attend to the scan, they can't meet for the first time their baby. But I think the most important for me was the hidden touch, the hidden smile. We couldn't hug each other anymore. And our smile is hidden behind the mask. This I think was the biggest struggle for everyone. I'm going to let Sam.
Well, I like what Fatima has said, because she's covered most of the struggles that we have in the profession during this pandemic. And unfortunately, we are still in the pandemic. It feels like we are still at war. For me, I, as a parent, as a friend, as a sister, as a colleague, as, a cousin or an auntie to everyone, it has been really a difficult time in terms of support. I've been supporting everyone, but sometimes you get to a point where you think, oh my God, I've been supporting everyone, but who is supporting me? I always say to people, you can never pour from an empty jug or an empty cup. It's so difficult. And it's lovely to have people that I work with. I come to work and I come to Fatima and say, I've really struggled, says, what is it? And we talk about it. So basically, I'm a mom to two healthcare professionals who are also in the front line. On the picture is my daughter Andile. She is working, well, she works in NE, now she works there part-time, but she now works for NHS, for Public Health England. But to be honest, when the pandemic started, she still lives with me at home. When she went to work, when she went for those night shifts, when she went for those long night shifts, I would not sleep. The anxiety, the stress, the fear of death, the idea of my daughter being out there, and it was worrying as a patient. I know she's got to be out there because it's her job. She's doing what she loves. Just like when I go for my night shifts, I'm sure she didn't sleep, but I would be, worrying more about her. When I went out, it was fine because I'm doing a job that I love. I'm going out there for the care I have for the women, for the care I have for my colleagues, for the care I have for everyone that I'm looking after. But to be honest, you come back home in the morning and Andile is going to work. You're thinking, oh my God, what if? It's not just Andile. My eldest is also a nurse in a different capacity in mental health. Again, COVID has been everywhere. I'm a person that comes from a family of healthcare professionals. So all of us in the front line, you're just constantly thinking, oh my God, what's going to happen? Talk about burnout. You get to a point where you think, I can't do this. I really cannot keep going. But the love for the job, the love for our women, just that idea to make a difference. We go out every day and we continue to be at this war, and we continue to want to make the difference for our women. And, the support has been amazing. At my workplace, I would like to say, although sometimes we've been very short-staffed, we have been able to support each other and we keep holding each other's hand. So there's a fight or flight. You don't know whether you have to keep fighting or do you have to flee. Like Fatima said, you are like, should I quit? Should I stay here? Should I think about my family back home? Should I be in Zimbabwe where my other family is, or should I be here to keep going? But for the love of the job, we keep going. For the passion that we've got for midwifery, for the passion that we've got for doing what we do, we just keep going and supporting each other. I said my workplace has been very, very supportive. They have, haven't they? In terms of just making sure that we all go through this pandemic. And I've just said, if you help me to keep my crown on, as I support you to keep yours on. So basically, we've been each other's comfort. How are you doing today? Just having someone asking you how you are doing, although they know that you're not doing that great, because at the end of the day, the pandemic is here and it keeps going. Now there's questions about, okay, what do we do? We are from the BEM background, me and Fatima are from the BEM background, and then you get women coming to you that are also from the BEM background, because we look after women from the BEM background in our teams. They ask you about the vaccination. What do we do? Should we or should we not? And as healthcare professionals, yes, we know we should. And then they get the social media coming and saying, maybe you shouldn't. So it's just really trying to teach women or trying to teach our colleagues, even to teach our families, because it's a new thing. No one knows which way they should go. And there's just all those issues. And to be honest, they do play a lot with your mental health. They play a lot with how you feel. You don't know whether you're, again, to fight or to flee. It's always there. So my main point in this is, if as healthcare professionals or as midwives or as nurses or anyone who's out there in the front line, if we just continue fixing each other's crowns, because our crowns are probably, most of our crowns are sort of hanging halfway, but with the good stuff, with the good support, we can actually fix each other's crowns. And yeah, I think in the nutshell, that's what I think.
Thank In the last slide, I wanted just to give what we identify as kind of solutions, because during this last year, as Sam said, teamwork was everything. Like, the only thing made us going to do 12-hour shift is the hope in your colleague. Supporting each other, because trying to make that work condition better. And I think it's really important, the listening. We need empower the staff. We need to make them feel are a part of the change. They can shape the culture. They can take decision, part of the decision. This was what was really needed during the COVID. And as well, the fairness. We need equity. We need more proactive approaches to diversity and inclusion. And as well, to encourage the midwife to stay, giving them more opportunities of learning, development. But what we really need, we need compassionate leadership. This is what is really needed, because when you have compassionate leadership, you support, you listen, and you empower. As a midwife, we empower our women. As the leaders, we need to empower our staff. Thank you.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.